Clinical governance is a systematic approach to maintaining and improving the quality of patient care within a health system. The aim is to ensure high quality care is delivered, which is measured against a recognisable standard, that there is accountability and a direction of continual improvement. Across the NHS, individuals, teams and organisations of all levels, whether local, regional or national, are expected to share this approach and participate in clinical governance activities. Good clinical governance comes from awareness and deliberate action in relation to the following 7 areas: education and training, clinical audit, clinical effectiveness, research and development, openness, risk management, and information management. Let's start with education and training. Medical knowledge continually develops in both breadth and depth. As a result, recognised best practice and options of methodology, investigation and treatments continue to advance. In response, deliberate and managed continued professional development is essential for ensuring that clinicians, teams and organisations offer the highest quality care to their patients. The emphasis here is on both learning and teaching. Each doctor learns throughout their career via their own unique experience. There is a risk that knowledge and insight is lost unless it is passed on. Equally, there is a risk that defective practice can be shared, so each doctor should ideally develop the skills required for being a good teacher with attention paid to what is being taught to others and how. Clinical audit is a cyclical process of improving care. There are 4 clear steps: identifying a recognisable standard, measuring performance by collecting relevant information and data, analysis of this information and data in comparison to the standard, and initiating change as appropriate. This ongoing cycle can start at any point. However, the identification of a recognised standard is an essential step. You may, for example, discover that your personal wound infection rate is 5.5%. But what does that mean unless you know what the national average infection rate is, or what the target is? A standard can take many forms. It may be a recommendation from NICE, guidance from a Royal College, a desired goal defined within your own organisation or team. It could even be any of the individual elements of good medical practice to which you choose to compare yourself, your colleague or your team against. The cyclical nature of a well-governed audit process means that the impact of any change initiated should be measured to check progress. Changes we initiate won't always have the desired level of impact we hope for. Sometimes there can even be unforeseen negative consequences or side effects. So far, we've ensured we are up to date with the latest evidence through training and education, and we have measured our practice against standards by auditing. But what about clinical effectiveness? Does what is being done and the way that it is being done make a worthwhile difference? In modern practice, this has to go beyond consideration of whether an intervention or process works on a technical level. Is the intervention appropriate? Does it bring benefit and does it bring value for money? Is it efficient and safe? And these questions need to go beyond the level of an individual patient. How does it impact on others? How effectively are all patients and the wider public being served? What about carers and their families? And what's the impact on those providing the care? Research and development is the 4th area of good clinical governance. We need to be continually advancing knowledge, skills and possibilities. We need innovative ways of treating patients if we are to improve on what we have always done. However, best practice is based on solid evidence. Any clinician participating in research should ensure that it is being conducted in keeping with good project management disciplines. And every clinician needs to be cautious of weak science, assessing evidence to clarify and decide if it is something which can or should be incorporated into everyday practice. Openness, with a willingness to share and communicate with all other stakeholders, promotes accountability. This, in turn, drives both achievement and progression of standards. Appropriate information, in both level and style, should be shared with patients, colleagues and the various partner organisations which make up the NHS and contribute to the regulation of UK healthcare. Openness should also go beyond simple transmission of information. Good governance includes being willing to hear what others have to tell you, the good, the bad and the ugly. As healthcare is full of risk, a conscious, deliberate effort to risk management can lead to benefits all round. Risk needs to be considered on a number of levels. We should not just be identifying what are the risks to patients, but what are the risks from patients? What are the risks to and from the doctors, to and from others involved in providing the service, carers, the team, the organisation and so on. When risks are identified and clarified, clear decisions should be made regarding the most appropriate course of action. Incidents of errors, complications and near misses should all be logged and utilised as valuable sources of information for learning, providing evidence of risks which require action. With this type of approach, risk management helps to maintain and improve the quality of care. Finally, information management is essential. Balance has to be reached in a number of ways. Accessibility versus confidentiality, quality versus quantity, initiating versus responding, summary versus detail. These 7 areas of clinical governance overlap. In combination, they ensure that patient care is safe, reliable, effective, and progressive.